Everyone to our webinar. I hope you are able to hear me well, and hopefully you'll see slides on your screen. And I'll hold on just a second. Okay. There we go. Okay. So the plan today is that Dave Arbach and I are going to tag team together in giving this presentation, as Christy mentioned. Now, I'm going to get us started by presenting some very new data on trends in nursing education. Then I'll hand the microphone over to Dave, who will talk about how RNs that are prepared with an associate degree versus RNs prepared with a baccalaureate degree, how they are faring in the nurse labor market. After that, Dave will hand me back the microphone, and I will summarize and suggest some implications. And we should then have time for 15 or so minutes for questions and trying to address those, any that you may have. Now, I want to begin by disclosing that the research that is reported today is funded by the Gordon and Betty Moore Foundation's Betty Irene Moore Nursing Initiative. And also, I thought it would be useful if just to provide a little context before we get going into education and labor market trends. Now, this slide provides quite a bit of information, and I thought I would just briefly review this. And note here that we are showing the number of FTE registered nurses, that's full-time equivalent registered nurses, the supply over time when we begin way back in 1973 and we go all the way out to 2020. And you can see the number of FTE RNs in thousands all over here on the left. So when we go back to 1973, we see that our RN workforce has been growing steadily and moving throughout the 80s, adding more and more RNs, growing throughout the 90s. And right around 2000 is when we make our initial projections of the future supply of registered nurses in the country. And we publish that in the Journal of the American Medical Association. Now, what we expected would happen is that the supply of nurses would continue to grow, and you can just sort of see this in black in these bands here. These are confidence intervals. And we still see that the workforce is growing, but not as fast as what it had in the prior 2 decades. And by the time we get out to about 2012, 2013, the workforce peaks, it sort of plateaus, and then starts to drift downward and decrease in numbers over the remaining half of the decade to the point to where in 2020 is about the same number of RNs that existed at the time we did the survey. Now that's what we projected, and we projected that because we knew that the large baby boom cohort of RNs, they would be reaching their 50s and their 60s during this period, the current decade, and would retire out of the workforce. Now, but look what happens here. The black is what we projected, but what really happened is shown by the blue line that picks up right after 2003 and increases. Now, this increase actually is about 500,000 more RNs today than what we had projected and what others had also projected. So that's one bit of context. Now, second, just recently, roughly a month or so ago, the Health Resources and Services Administration produced new forecasts of the supply and demand for nurses. And what I just want to highlight here is that these new demand estimates show that demand is expected to increase by roughly 21% through 2025. And so you can sort of see maybe 2 questions emerge right offhand. One would be, now that we have these new demand estimates, does this supply of nursing that we looked at just a second ago, this growth, will it continue in the future? And if so, will it be enough to match this new estimate of demand? Now that's a great question, but it's not the one we're going to deal with today. Rather, the question we're going to tackle is what explains this unexpected increase in the supply of FTE-RNs that began since the mid-2000s. So that's the question we're going to try to address. Now, we think that there are mainly two big contributing factors that explain this unexpected increase. One of them has to do with some information I'll share with you in just a moment about RNs over the age of 50 are staying in their nursing career for a longer number of years than we had expected. The second factor is that we have documented a surge of young people coming into nursing in the since about the mid-2000s. We're going to look at both of these in greater detail next. So with regard to the first explanation about the lengthening career span, a few years ago we noticed, looking at the larger economic and labor literature, that today people, and particularly women, are spending several more years longer in the workforce than women had done in prior decades, the 70s, the 80s, the early 90s. And we wondered, well, if this trend is going on in the larger labor market, could it also be occurring in the registered nurse workforce? So this analysis was then aimed at determining if these trends occurred in nursing. And what you see is back prior to our forecast, between 1969 and 1990, once an RN reached the age of 50, he or she worked for an additional 11.5 years on average. But when we go back and look now at RNs between 1990 and 2012, that same RN over age 50 now spent additional years in the labor market, and about almost 3 years additional time in the labor market. And we add all these additional contribution to the labor market, sum all that up, and we estimate that that has expanded about the size of our workforce by about 135,000 FTE-RNs. So a moment ago I said we had 500,000 more RNs than expected. We think about 135,000 of that is accounted for by RNs who are spending additional years in the labor market. Now that additional years controls for the effects of the recessions as well. So this is what we think is the first trend. The second trend, the larger trend, is this entry into professional nursing by young people. And here we go. And I want to set this up by showing you this slide. Let's start over here. We start in 1973 and we go out to 2013 on the bottom, and we show the number of FTE-RNs. These are nurses who are 23 to 26 years of age. Now, as we look at the left side of the figure, we see large numbers each year, starting in the late 70s, of RNs who are young, 23 to 26. Now, think back when they were born. If they were 23 to 26 in this time period, that means they were born in the sort of near the peak of the baby boom generation. Now, those nurses born between 1946 and 1964, the baby boom period, large numbers of people born in the population, and when they graduated from high school, at that time, the career occupations largely were nursing or teaching. And so this explains why we see a large number of people entering nursing at these young ages in the late 70s and early 80s. But then we see this decline. Fewer people are born, the baby boom, out of the baby boom generation. We're passing that, and there's a greater expansion of career opportunities. And so we start to see a dramatic decrease in the number of people at these young ages entering nursing. Now, if any of you know me, you'll know that I have pretty white hair, and that's when my hair turned colors, because I, needed to see a change. We needed to see a pickup in entrance of young people into nursing, because we would have to eventually replace all these baby boomers. And so we weren't seeing that. And we lived through the decade of the 90s with small entry of young people coming into nursing. And in fact, when we made our forecasts right in 2000, when looking back over the recent several years, there was very little reason to give us hope that we would ever attract people into nursing to the degree that it existed in the past. But lo and behold, look at what's going on the right side of the screen. We see this steep increase in numbers of young people coming into nursing. As you go all the way out to 2013, and notice how high that number is, it's the same or maybe even exceeds a little bit of what the baby boom generation is producing. So this was it's a welcome, it's a hoped for change that we were wanting to see, but really unexpected. And so now, given that, why did this happen? Now, so I've listed on this slide what, in my mind and Dave's mind, really, might represent some of the reasons that we see this tremendous increase in nursing. Now, when our projections were published, they were published in JAMA, they were given a large circulation. It seemed like everybody knew nursing was in trouble unless something happened. And this slide shows a rather significant response to those projections back then. I want to note that the Johnson & Johnson campaign for nursing's future, it came online back in 2002, and in the early years of this campaign, it spent roughly $30 million over the first several years in this campaign. So some of you might remember there were ads about becoming a nurse broadcast during the Olympics, during the Super Bowl, television advertisements. The campaign sent mailings to every high school guidance counselor in the country about becoming a nurse. There were numerous other initiatives that we don't have time to talk about that came out of J&J, but they were all intent about in showing a favorable image of nursing and challenging people to become nurses. Now, that was the Johnson & Johnson campaign, but it was also reinforced by others. And I note just a handful, but literally that we could do 2 more slides of other groups that came forward. But these are the notable ones. The Sigma Theta Tau International had a campaign in the 2000s. The Robert Wood Johnson Foundation, already active in nursing, increased its activity, and over the past decade or so has spent roughly $500 million in one way or another through their initiatives to support the nursing profession. The Gordon and Betty Moore Foundation launched its nursing initiative, the Betty Irene Moore Nursing Initiative, in the mid-2000s that added significant impact to these already existing campaigns. The private sector came forward in many, many ways, everything from Kiwanis clubs and corporations providing funding for nursing education, faculty, loans, and scholarships. During this past decade, the states have developed workforce centers. Now we have roughly about 35 states that have some sort of a workforce center that is collecting data on the demand, supply of nurses, and getting information out about the profession in all the states. We also had 2 recessions, early in the decade and then the Great Recession in 2007 and 2009. Those send powerful messages to people about becoming a nurse, because as we all recall, during the recession, the one big sector of our economy that continues to grow and hire is healthcare. And so there it is, nursing, continuing to add employment during a time when most people are losing their jobs and the economy is shedding their jobs. So the recessions provided a big input. And then the education, our nursing education programs were not stagnant at this time. They were very dynamic and started to develop new education initiatives, expanding their capacity as well. And I want to add, now show these trends. We just published these trends in the November-December issue of Nursing Economics. So if you want to see these and get sort of a bigger write-up, you're more than welcome to go to their journal and you'll find these. So let me take a few minutes and show you what we report. So we look at data from the IPEDS, the Integrated Post-Secondary Education Data System. We go back to 2002 and we track through what is going on with the number of graduates through 2012. And you can see we have a large increase. We were graduating in 2002 roughly about 77,000 new RNs. Now in 2012, or not, now, but in 2012, that number had shot up to 188,000. So a huge increase. And this increase was broad-based. It included all demographic groups. It occurred in all different types of education programs that were based in either private or public institutions. It affected both associate and bachelor degree programs and graduate degree programs, as we'll see in a moment. And it was especially apparent in private for-profit schools. Now, let's look at some numbers even more closely. And so this slide shows the growth of RN graduates from 2002 to 2012. And let's look at baccalaureates initially. And you see back in 2002, 35,000 roughly. By 2012, almost, well, 3 times that number, 98,000 roughly. So a threefold increase in the production of new baccalaureate degree nurses. Associate degree nurses, back then in 2002, we see about 42,000 a year, and their numbers have doubled during this 10-year period, up to about 87,000. Now, the public school, the public programs doubled roughly in their output from 59,000 in 2002 to about 120,000 in 2012. The private not-for-profit programs, they tripled from 16,000 to 45,000. But look at what's going with the private for-profit programs. An astounding 1,700% growth. That is not an error. Their number of programs, or number of graduates, excuse me, in 2002 was about 1,100. By 2012, that number was just under 20,000. So that was another increase. Now, if we look at some of the public and where these programs are based, I don't want to spend too much time on this, but just to note that all of these programs, public, private, and not-for-profit and private for-profit, all of them grew. All of them added to the number of schools. And so the public programs increased by 222. The private for-profits increased by almost 180, but the private for-profits increased the fastest by 258. And so this is when you look at the sort of the market composition, the public programs actually kind of fell in terms of their market share to accounting for about 59% of the graduates. The private not-for-profits stayed roughly the same, 28%, but it was the private for-profits that grew from 34 programs to 292 programs. That accounted for about 13% of the market, or the output, if you will, of nursing students by 2012. Now, I'm going to stop here, and I'm going to turn the microphone and the slides over to Dave, and just give us a few seconds to make those technical switches as Christy takes over.
Okay. Can everybody hear me? Can you hear me?
Yep.
Okay.
1 second,
Good.
Dave, and I'll make you the presenter here.
Okay.
Okay, I see your screen if you just want to bring up your slides.
Let's see. I've lost the. Why don't you just bring it back up from your point of view, and I'll just have you switch them because.
Okay.
Okay, we can do that.
Okay.
Okay.
Okay. All set. We're on number 18.
Yes.
Okay. Sorry about that, everyone. This should work out. Thanks for the introduction. Okay. So far we've been mostly talking about RNs generically. All RNs, even including those who might have advanced degrees. So for the next segment of the talk, we're going to hone in a bit more on the two major degree pathways towards becoming an RN and talk about them separately. And you'll see in a little bit why we think this is an important distinction, but it's probably obvious to most of you that that there's really these two routes that involve different types and different amounts of education towards becoming an RN, and there's some interest in policy in distinguishing between them also among those who employ RNs. And we wanted to really think about what are the role of the two types of education towards becoming an RN. So we'll be talking about the associate degree programs, which are typically a 2-year degree in a community college. Some of them are online, and some of all programs are online these days, but mainly that in contrast to the baccalaureate degrees that lead to a BSN. Those are usually 4-year programs. And keep in mind that there are also programs whereby someone who initially gets an associate degree then can, maybe in an 18-month program, convert and get the additional education towards becoming a BSN. And for most of the talk coming up, we'll be distinguishing between those who did not do that, but whose highest degree or the extent of their education was an associate or a baccalaureate degree. And of course, a lot of RNs, and the last bullet there, continue on to become an advanced practice RN or a DNP, a doctorate, different kinds of doctorates, and we're not going to be talking about those for the rest of the talk. Okay, let's continue. So as I was getting at, some of the interest in a policy level in thinking about these different routes to becoming an RN separately. In 2010, the famous report by the Institute of Medicine called The Future of Nursing recommended these higher levels of education. They suggested that by 2020, 80% of RNs ought to have a BSN. And this was based on some prior research, some of it by Linda Aiken, about differences in outcomes, better in some cases for those with a BSN, and just coming from the increasing complexity of healthcare, thinking that the additional education was helpful and important to be able to handle the demands of increasing complexity of patients, of coordinating care, of managing just more intensive conditions and so on, and the complexity of the way care is delivered. But in any case, it's still true that half of RNs today are educated via the associate degree program. And we would be in a difficult place if those suddenly disappeared. Okay, let's move on. So the next couple of slides, we are still back in the data from the iPads that Pete was using, and then we're going to switch to a different data source, which I will mention when we do that. So here is showing those same trends in the degrees that people have obtained over time, showing a longer time series. And we're separating out the number of associate degrees and the number of baccalaureate degrees. And you can see that the associate degrees were pretty much higher all the way through. These lines are roughly parallel. You see the big run-up starting in 2002. And just towards the end, these lines do start to cross. You see the baccalaureate degree rising a little bit faster. And that is probably not an accident. That is, again, related to some of the things I'll be showing you later, where it does look like the IOM and other policy recommendations and preferences might be starting to have an impact in the value of these degrees or what people are seeking. Okay, let's move on. And here's just a slide showing those who get degrees beyond the basic nursing education, the master's and the doctorates. The IOM also recommended, I think, a doubling of the number of RNs with higher degrees. And you can see this very large increase starting around also 2002, those going on to get additional degrees. Okay. Okay, so given the trends in the degrees that people are getting, we wanted to next ask the question, well, if this is true, if we see the IOM recommending a higher mix of BSNs, and we also hear and see evidence that some employers are saying, you know, we're not going to hire the ADN straight out of school, especially some hospitals saying that they really prefer those with the BSN for whatever reason that they have in their mind. We wanted to see, well, these are the kinds of things that you kind of hear on the street. Are we seeing this in the data? Are we seeing these kind of differentiations going on in the labor market? So here's where we looked at the data from the American Community Survey. And just to give you a little bit of background on that data source, the ACS is a 1% sample of the entire U.S. It's a census-based sample that was expanded in 2001 and then in 2005. And it has general education descriptions. So it's unlike the National Sample Survey of RNs, which was discontinued in 2008. That one was a sample of nurses specifically, and you could hone in on exactly what education nurses got in leading up towards becoming a nurse, including the diploma programs, which some of you know about. Here, in using the ACS, it's not specific to nursing, so we had to make some assumptions and approximations. And I won't go into the gory detail, but we were able to compare those assumptions to the National Sample Survey when they all were existing in the same year in 2008 to make sure that our assumptions were pretty close, and they were. So what we're doing is using this general data source that ends up surveying about 33,000 RNs per year and dividing them into who looks like they were a bachelor's degree and associate degree nurse. And we aren't able to see the diploma nurses, but they are a tiny, tiny percentage lately. And we don't include those with a master's degree or higher. So here, using those assumptions, here's, again, the trend in the number of RNs. So before we showed you from the iPads the trends in degrees being earned. This is a little different. This is showing of nurses who are out there working in the workforce, what degrees do they have? So it's one step beyond education into who is in the workforce. And here you see, with the green line, the baccalaureate nurses are higher than the associate degree nurses, whereas before they were lower, and that is probably because of those RNs who then later convert from an associate to a baccalaureate. And we see that gap widening towards 2010, 11, 12, 13. You see the bachelor's nurses, a larger and larger share of RNs. Okay. So the first thing we looked at, then separating out the two groups again, the ADNs and the BSNs, we wanted to ask some questions about them. Are they having different experiences in the workforce? And the first thing we looked at was, where are these RNs employed? And this is the most striking finding from that. This is the percent of RNs of each type working in the hospital sector. And you see this really large divergence starting around 2003 when we first were able to see this. The ADNs in 2003, about 65, 67% of either type of RN were working in the hospital, and the ADNs just decreased from there gradually down to about 60% in 2013, whereas the BSNs increased their percentage who are working in the hospital to the point that now there's about a 10 percentage point gap, a very large gap, you know, given that this is looking at all nurses, not just the ones who are newly coming out of school, but even those who have been in the labor market for a long time. That's a really significant difference. And that is showing strong evidence of the stories we hear of the hospitals who are increasingly saying, no, we just want to hire the BSNs. Okay. We looked at a couple of other labor market outcomes, but here, still back on the employment setting of where people are going. Well, we wanted to ask, where are those associate degree nurses who aren't going to the hospital? Well, where are they working otherwise? Where are they finding employment? Because most of them, as you'll see in the next slide, are finding employment somewhere. And the smoking gun was pretty much the long-term care sector that I circled there. You can see the percent of ADNs working in long-term care increased from about 13 to 18% over the same time range. So that is probably where a lot of those who would have been in the hospital are finding work. Okay. Then we looked at overall employment. Are some ADNs, okay, maybe some of them aren't getting their first choice of employment setting. Are some of them having trouble finding a job at all? And as you see here, a couple of things to note. First of all, overall rates of employment of RNs are incredibly high. There are very few unemployed RNs, and that's the way things have always been, and that's partly explaining, as Pete was saying, you know, as the economy has struggled over the last decade, nursing is pretty much a very good career in terms of stability of employment. But in any case, we do see this small divergence starting to open up around 2009 and 10, again, where the percent of ADNs who are unemployed separating from the BSNs and growing to about 2%, slightly higher in 2011, 12, and 13. And you know, given the large sample size, that is a significant gap, although, again, we're talking just about a 1% difference here. Okay. And the final thing we were able to look at using this data was wages. So if the labor market seems to be preferring the BSNs, is that showing up in higher pay? You might think it would, but we don't actually see that. So here we have 4 lines. It's a little bit confusing, but we wanted to analyze earnings both in the hospital and overall. And so the hospital is comparing the purple line on the top for the BSNs and the green line near the bottom for the ADNs. And you can see there's a wage gap of about $10,000 per year between the BSNs and the ADNs. And that sort of stays constant all the way through. And then the other lines, the red and the blue, are a parallel series for not just the hospital sector, but everywhere. You can see that roughly that same $10,000 earning that stays pretty much the way through our data. So from this, you would say, well, you know, despite that divergence, that difference in what sectors people are finding employment, it doesn't seem to reflect in, you know, a growing wage gap. The wage gap pretty much stays the same. So that's an interesting finding, and we don't fully understand exactly why that is the case. There's clearly employers are finding value in where these nurses are going. Okay, next slide. So okay, so I will end there. So those are sort of the main findings, and that is going to be in another paper in Nursing Economics that's coming out within a month. And Pete's going to talk about some of the implications of these findings.
Okay, Dave, thanks very much. And you'll hear from Dave, I'm sure, in a few minutes when we get into some of the questions and answers. But I'm going to try to wrap things up in the next few minutes. But I'm going to do it by adding in a little bit of a different twist. And that has to do with the notion of value and nursing, the value of nursing, actually. And we all know value is sort of the quality of the costs of the services or product treatment that's being produced relative to its cost, and we want to improve the quality and keep the cost down or lower it, ideally, to improve value. And most of you on this webinar, I am sure, are aware that over the past decade we have seen not only evidence that nurse staffing matters to reducing the risk of adverse inpatient outcomes, but hospitals that employ a higher proportion of nurses educated with a baccalaureate degree have better patient outcomes and cost-related outcomes. Now, some of you may not have seen some recent studies that have been published, and I've been particularly attracted to work by Ove Yakasheva at Michigan, Rich Lindruth at Colorado, and Rena Weiss, publications in 2014 that built on some prior work that they did in 2011. And as the screen shows, it just that higher proportions of baccalaureate nurses are related to better outcomes, lower costs. Now, value has really taken off as a one of those words that we hear today, like team care and care coordination. And I think that is owing a lot to healthcare reform. Now, here in health reform, we mostly hear about value-based purchasing or value-based payment. And we've already experienced some of this in healthcare with hospitals back in 2008, the CMS program on never events, really, I think, significantly began that movement towards a sort of a value-based payment that hospitals have been dealing with ever since then. Private payers have also had their unique offerings for hospitals. But now, today, the value-based modifier is being developed for physician payment. In another couple of years, physicians and nurse practitioners' payments will be based in part by the value of what they're producing. And so the question I think about, and Dave and I have considered, is, what does this all mean for nursing going forward? And we really think that it will require nurses to become increasingly value conscious and anticipate maybe downstream that payment for nursing will become increasingly linked to value, whether you're employed in an organization or not. And really is this notion of, are we on the verge of looking at value-based employment of nurses? And, let me go back to this slide because think about this in a second. As you were looking at the slides that Dave showed you just a moment ago on the unemployment rates higher for associate degree nurses, the employment of baccalaureate nurses in hospitals increasing, whereas the employment for associate degree nurses in hospitals were decreasing, the earnings, etc. Those trends actually were occurring before 2010 when the IOM had recommended, of course, a greater proportion of nurses educated in baccalaureate programs. These trends actually occurred in the mid to latter part of the decade. And I think what might be an explanation for that is that there was information given out initially by Linda Aiken in her studies back in 2004-05 that first documented better outcomes with baccalaureate nurses. That information was available to hospitals and it increased over time. But then it was wedded with incentives when Medicare held hospitals accountable for the outcomes. So now hospitals suddenly see, the value of a baccalaureate nurse has risen relative to that of a nurse without a baccalaureate degree. And so that, I'm not saying that's the explanation, but it sort of makes some sense when you go back and look at some of Dave's slides. And so if you buy that, I think that it's important to pause and just sort of look at this slide, that, again, drawing from work from Olga and Rich and others, and where they're really looking at the value-added aspects of nursing and patient outcomes. And so I think the last bullet point is the most important one, and rather than you listen to me read it, I'll let you just take a moment and look at this. I think for me, what it says is that looking to the future, employers will be looking for that nurse who brings the greatest value to their organization in terms of quality and in cost, and their employment decisions may be increasingly based on value versus other factors that we've seen. Now, I don't want anyone to, on this webinar, to think that we are making a, quote, value judgment that associate degree nurses don't measure up to baccalaureate nurses. That's not what we're saying. We're saying they're different. They have different value in different sectors of the healthcare delivery system, and we've shown you some evidence where hospitals seem to have realized that, and that value, though, is for associate degree nurses seems to be higher in the non-hospital setting. But as Sue says, we need everybody in on this together. So let me bring our webinar to a close by a few summary statements. Dave and I and the other partner on our team is Doug Stager at Dartmouth. We all agree that we believe that we should continue to sustain and nourish this surge of young people who are entering entering the profession. At the same time, we're seeing evidence now that associate degree nurses relative to baccalaureates are earning less. They have a slightly higher unemployment rate, and the favored areas for their employment are increasingly in non-hospital settings, particularly in long-term care. We put all this together and we are beginning to suspect that maybe value-based employment of nurses is sort of right around the corner. We still have 1 million RNs today who are over 50. Many will retire over the decade. Yet we're pleased to see these long-term supply projections have turned positive. This is a great development. It's driven largely by the surge, by these lengthening careers of the existing baby boom RNs and by this recent surge of young people becoming RNs. And I think this shows in some degree that big national initiatives can work to reverse the trends that we began the decade of 2000 with. It's been a surprising growth in nursing education, not just the numbers, but the types of programs that are producing nurses, particularly the private for-profit, and now we see that the baccalaureate production of nurses is clearly on the rise and overtaking that of associate. We feel that, yes, it's great to have a big supply of nurses today, much better than the situation we faced a decade ago. But we also have health reform and value new going forward. And so we don't want to compromise on the quality of nursing education. And in fact, we really believe that probably it is maybe even more important to be focusing on what is the quality of the nursing student that we're producing today. We need to strengthen the preparation of the future nurse so that they are well aligned with the skills and knowledge to participate in achieving the goals of health reform. That means educators, particularly, need to stay very closely connected with employers, not just hospitals, but non-hospital employers as well, to understand how the employers are responding to health reform, the new initiatives that will require nursing, and the different skills and knowledge that will be required of nurses in the future. And so educators need to be understanding that and producing nurses who will go into these organizations in the future and add value, and particularly to adjust our curriculums for shifts in care delivery to non-hospital settings. Most nursing education curriculums in the country today still educate nurses around care in acute care settings. And much of the licensure examination for nurses today is based on acute care nursing. We need to change and move that more to emphasize non-hospital settings. Finally, we've got 1 million nurses who will eventually be retiring. Is there a way that we can use these nurses some way after their retirement so they can still contribute and add value to our healthcare system? Just as one final thought, maybe many of these nurses could be very good at hospice care, but could require some training and experience in being a good hospice care. Maybe this is where schools of nursing could develop education programs to sort of retrain nurses, retiring nurses into hospice nurses, and all kinds of other opportunities as well. Well, I'm going to stop here and say thank you to all of you who've joined our webinar on behalf of Dave and Doug Stager as well. And now at this point, we'll turn it over to Christy, who's been watching the screen to see what questions may have arisen.
Right. So apparently you and Dave have dazzled everyone into complete understanding at this point. Don't have any questions logged at this moment, but we can pause for a minute or two and collect any if anybody has any. And yeah, while we're doing that, Dave, is there anything that you'd like to add to some of the discussion we've had today?
Thanks for giving me a chance. And thanks, Pete. I think that was a really nice way to tie in the changing incentives, the increased attention to value among healthcare organizations that could be driving some of these trends, some of these preferences, and there's variation huge variation among nurses that are educated in any way. And we're not saying that any individual associate degree nurse has lower value, but organizations are making sometimes they have to make some kind of an average assessment in who they're going to bring on. And it looks like what we're seeing is, in some cases, they are just making this average assessment and saying we're going to prefer those with this type of education, considering that that's going to be more favorable for us in this new world of more attention to these kinds of outcomes that there's some evidence linking to. And I think one other thing I want to add is that way back in one of Pete's early slides, when we were talking about what were the different causes of this huge surge in education, and that was a great discussion of the range of things, and we don't definitively know what contributed more. It's a great question and something that we're going to continue to try to learn more about in future work. And it's important to know in case we find ourselves in a similar situation in the future, or even that other professions could learn from. What types of interventions, if any, really can have an impact like we've seen in the nursing workforce, and how much was due to the kind of overall market conditions that related to the recession and so on. It's hard to pull apart cause and effect at this point, but there's more that we will be doing to learn about that. That's all I had to say. Thanks.
Okay, thanks, Dave. Christy, any takers at this point?
Doesn't look like it. Looks like we've have a fully satisfied audience.
Oh. Well, that's one interpretation. We'll go with that one too. We'll stick with that. Well, I guess then maybe we'll just close the session. Just note that the data on the trends in nursing was just published in Nursing Economics in the November-December issue. Dave is the lead author on the paper that looks at the associate versus baccalaureate, how they're faring in the labor market. That paper will come out probably, I would imagine, maybe the second week of February, also in the Journal of Nursing Economics. We're working diligently on new forecasts of the future supply of nurses. We're finishing up a paper. We'll get that out for peer review over the next month or two and see how that turns out, but we're excited about that. We have another, a large portfolio of research that we're continuing to do, all trying to add new data, new insights onto the changing dynamics of the nursing profession in this era of health reform. Okay. Well, you say that, Christy. She wants to talk about our website, so I'll let her finish it up for that.
I just wanted to mention that we have a lot of data that we release exclusively on our center's website at healthworkforcestudies.com, all one word there. And so it's nice to check that on a pretty regular basis. We've also started sending out monthly newsletters, the Center Point. So if you didn't receive that this past month, you're probably not on our mailing list. So there is a format on our website to sign up for that and give us your email address so that you can be part of that as well. And don't forget about our conference coming up in June. That is right around the corner. More details on our website for that. And we're going to post some more details about our next webinar event, which is to be determined still at this point, but we are hoping to have one in February. So keep an eye on our website for that information as well.
Okay. Dave, thanks very much for your time. Appreciate it. Christy, thank you.
Thank you. Great.
All right.
Thank you.
Bye-bye.
Thanks, everybody. Bye-bye.